What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
What happens when 2 raindrops fall in love? They become rainbows. What happens when Dwayne Johnson and a pig give you a hug? You're stuck between the rock and a lard place. I think asparagus might be an untapped power source. 'Cause after you eat it, it seems to produce a lot of enriched uranium. By the way, I have a routine you might like. I can welcome you home with the day's news and relaxing music. Do you want to try it? No problem.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve! Take a cow from to the vertebrae. I need some touching.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The weirdo alternative medicine people. Hello, Dr. Scott. Hey, and we also have Tacie, my partner in all things. Hello, Tacie.
Hello.
And we have PA Lydia back from sabbatical. Hello, PA Lydia. This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347... Uh-oh, poo head. I'm sorry, Scott. I don't have your mic up high enough. Well, try that again. Poo head. There we go. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, massage therapist, proctologist, or whatever.
Yeah, whatever.
We got to edit that list at some point.
Yes.
All right. Don't forget to check out stuff.drsteve.com. That's stuff.drsteve.com for all your Amazon needs. Please go there and just click through to Amazon if you want, or scroll down, look at all the cool crap we got on there that we talk about on this show. Stuff.drsteve.com. www.drsteve.com. And Dr. Scott's website, it's simplyherbals.net. That's simplyherbals.net. What do you got on there these days?
That nasal spray.
Okay.
Regular and CBD.
Okay, sounds good. And check out Tacie and me on patreon.com/weirdmedicine. We've already had some awesome guests on there, including Dr. Caldera from Better Call Saul was on there just a little bit. Joe DeRosa. He's the guy that plays the crooked veterinarian on the Better Call Saul. Do you watch that at all?
I watched Breaking Bad.
Okay, well
I like Saul.
You need to watch it. The first season took a minute, but then once it gets going, it's amazing. And you've got 5 seasons now that you can just binge through the whole thing. It's brilliant, and Vince Gilligan is still just amazing. And I'm waiting to see if the finale could be anywhere even close to Breaking Bad's finale, which to this day I still think is the best finale of any show, followed second by, what do you think, Tace? Battlestar Galactica? I thought that finale was great.
That was pretty good.
Yeah.
Listen to us nerds.
When you finally...
BSG, man. Yo, it's awesome.
So...
Best show on television.
So anyway, and if you want, I'll do Cameo for you. Go to cameo.com or on the app, just search for Dr. Steve Weird Medicine. I'll say fluids and secretions to your mom. I'll do whatever you want. It's dirt cheap. I just like doing it. It's fun. It's stupid. Now, I did have one group that was doing a medically themed performance, and they wanted to know how to pronounce the words. And so I pronounced them for them, and then I told them what they meant. And they said they found that very useful, although the program, the person who was directing it was not the person that asked me about it. And he said, oh, no, he's pronouncing those wrong. And it's like, okay. Yeah, I'm pronouncing them wrong. No.
Did they want their $5 back?
Well, I mean, yeah, I've been
it's interesting that
doing
they
this
told
almost
you
40
that.
years, and the guy thought it was funny. The guy that hired me. And I think it was Corky St. Clair was the musical director. So anyway, he knew more than I did about how to pronounce things like apoptosis and stuff like that. There you go. So last time, PA Lydia. Oh, please don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And last time we were here with PA Lydia, we had some people infiltrate our chat room that were saying very naughty things, and they were never there before, never there again. Your buddy, what was his name? Ben? Was it Ben? The guy from Brad. The guy from...
Oh, yeah, Brad.
Brad.
Yeah.
And
Brad Generou.
they watched the show, and they were like and getting mad, like they were going to kick those guys' asses and stuff.
Well, first they asked me if I were a woman, right?
Well, I wasn't going to say all the things that they said about you.
Well, it doesn't matter, but they
yeah.
just established whether there was any truth to it, because we're a very open and inclusive organization.
Oh, you mean Brad said that?
Well, actually...
because the people were, they were making unkind jokes toward P.A. Lydia, who's a delightful and lovely person. Mm-hmm. But...
they got a little offended. My crew.
They were madder than hell.
My crew got a bit offended.
Yeah, and all you were doing was sitting here trying to help people. And what I realized later, they never came back. So I have a funny feeling that the keyword that we used, which if I put it on there again, I'll spell it differently. I'll do it like UKRA apostrophe NE or something like that, because I learned to do that with not apostrophe, exclamation point, VERMECT, exclamation point, and when I wanted to talk about ivermectin. Well, I got one of my tweets got flagged by Twitter because I posted studies on clinicaltrials.gov, which, by the way, is a government website that showed 72 studies on ivermectin in COVID-19. I was just trying to say that it wasn't complete horse shit, no pun intended, that someone might think that ivermectin could possibly be effective in that there were scientific reasons why people thought that it had antiviral properties, and indeed they were there, and I got flagged by Twitter, so I started spelling it differently, but it's very difficult to spell it that way with exclamation points instead of letters. But anyway, so that was interesting. So I think I'm not saying we were infiltrated by Russian operatives, but it was definitely somebody that wasn't keen on what we were talking about.
Sympathetic, perhaps.
Who knows? Or just they're just trolls, which is fine too.
It's good to have attention, right? Whether bad or good, it's good to have attention.
One of my favorite shows, and some of my best friends are basically professional trolls. I mean, who are these podcasts? I spent a whole weekend with them and 300 of their fans. This last weekend in Nashville, they did a live show, and they're basically Carl makes a living trolling people. He calls it roasting, and really it is more kind of roasting because he's not trolling people on the internet. You know, he takes their content and comments on it and just shits on it. Mm-hmm. And but it was so much fun. It was great meeting everybody. Hung out with Carl and his lovely wife, Jenny Jingles, and got to sit on the stage, and I was so friggin' nervous, Dr. Scott. I was more nervous doing this than I was the first time I did Opie and Anthony, because it was a live crowd. We're on the stage. You can't see the crowd. You put on the headphones, you can't hear the crowd anymore. So it was like you were isolated. I didn't know it was hard to tell if you were getting laughs or any response or anything. And stupid Carl, I thought I was going just to sit in the audience and have fun. And he was kind enough, I'll put it that way, to invite me to be on the show. But I found out about it on Thursday, and I was to leave on Friday. So Thursday evening, I get an email from Carl. It says, be at the meet and greet at this time. And I thought he was sending it out to everybody that had tickets. And then I realized, oh no, he's talking about people that are involved. Wait, I'm one of the VIPs? Wait, I bought 2 tickets for the VIP meet and greet. I had to buy 2 tickets to meet myself. And then I had 6 tickets. And I guess that if I had known, I still would have bought them. But you know, there was a lot I just didn't know about. And he's like, well, we're doing this podcast. I'll let you know later. And then his wife was the one that told me, hey, we're doing this specific episode. So instead of just having a nice quiet, or not quiet time, but a nice time drinking Friday night at the bar that they had picked for the pre-show meet and greet, I had to go back and start pulling tape. Thank God I brought my Mac with me, and I had my audio editing software. But I had to listen to this damn podcast that we were reviewing. They don't review fun to listen to podcasts. And I had to listen to it at least 3 times to decide which clips, and then I had to pull the clips, and then I had to write stuff down. I didn't have a printer. I didn't even have a pen. So I had to put it in email it to myself, run downstairs to the business office that they had and print them out. It was crazy. So by the time I got there on Saturday, I was so over-prepared. Oh, plus, I had said, well, I'll just walk to the place, because I got the place because supposedly it was within walking distance. Well, Google Maps is great if you're driving somewhere. If you're walking somewhere, F you, Google Maps. It sucks. It got me going down one thing, and then the next thing I know, it's saying go do a U-turn, and then I do the U-turn, and then it'd make me go back the same way again.
Kind of sucks in Virginia too, have to say.
Yeah, it was terrible.
Mm-hmm.
And biking. Someone, I was riding a bike. I was on a bike tour one time, and we were using Google Maps to get ourselves from Virginia to Georgia.
Yeah.
And it kept taking us this horrible direction, but we just kept forging ahead until the road ended, and then the dirt road ended. And then we were in the middle of the field, and Vlad finally, after being silent, piped up, the third cyclist with us. He said, sometimes you have to be smarter than the technology you're using.
You can't just blindly follow it, yeah. Yeah, so I ended up having to be smarter, and I just saw the place, and I turned it off because it was ridiculous, and figured out a way to get there. Well, anyway, so I was hot. I was kind of, flustered, and then we get right in there, and I was running late too, so I got there just in time to sign a bunch of posters, which are really cool. I've got one. Oh, I was going to bring it in and show everybody who's watching live, but yeah, we had to sign 50 of those for the meet and greet. So I made it to the poster this year. Mint Salad is the name of their of their artist. And yeah, so I got to be on the poster. Of course, I look like that bald meme guy that's always mad. You know, that sort of minimalist bald meme thing. Just sort of looks like a head, and he's always mad. Anyway, I look like that, but that's because that's what I really look like. It's no flies on her artistic talent. But anyway, and then so they call me up, and I was having a blast. I mean, it was so much fun. I get up there. And I'm so over-prepared, I couldn't really live without my notes because I was prepared on paper, but I hadn't just kind of internalized it all. And there was no place to put the notes, and it was dark, relatively dark up on the stage, and I had my notes in my lap because there was no place to put them, and I couldn't see them, so I was looking down. And apparently I wasn't using good mic technique, and it just all kinds of shit. But got a couple of laughs and had a blast. It was great seeing everybody. And then during the Stuttering John segment, I got to stand up and I did a strip tease. Well, I took off my shirt to reveal the T-shirt that I had underneath, which was a, apropos T-shirt that was all in jokes. One of the guys on, I think it was Gamaron KY on Reddit said imagine trying to explain this T-shirt to someone. You would have to know like just a litany of things for it to all make sense. And the fact that it was green because John can't quite figure out how to work a green screen, there was just so many in-jokes on this stupid T-shirt. But anybody who was there immediately got all of it. It's kind of interesting. It's like language. Yep. If you look at a word, like you look at that license plate up there, you don't have to translate that to see that it says Weird Medicine. And you look at the icon next to it, you can tell that's supposed to be me, and there's a spine. You don't have to translate any of that. But if you showed that to a 3-year-old, they would just see a bunch of shapes and stuff. So, memes and meme culture and that kind of stuff, there is a language to it, inside jokes and comedy and things. You have to have some sort of background to get it. And I thought that was an interesting point. So anyway, so it was a blast. And that we had a meet and greet afterward upstairs. This place was at the Nashville Winery, which is a wonderful place to do an event. And it was nice. It was beautiful in there, way too beautiful for us, and you could order from your table just by clicking a QR code. So yeah, it was neat. And I really appreciate Carl letting me be part of it and including me in it. And there was a comedy show that night. There were 3 of the people that had been there did stand up at this funky little bar in downtown Nashville. And it was just a great evening. And, everybody kind of dug each other. There weren't any problems. Everybody was well behaved. And it was just a fun weekend. So when these come up again, everybody's listening to me. If you like Opie and Anthony, it's that same sort of vibe. I mean, it's the same. It's descended from the Opie and Anthony show, so that vibe is there, and they have it's kind of a joy and just silly, goofy roast type humor. So I'll keep you guys abreast of when that's ever going to happen again, because I know they're going to do it again because this one was very successful. Anyway, questions, comments? Okay, we'll move on. I just wanted to debrief, and Tacie hadn't heard half of that, so.
It's very interesting.
I get home and she's like, okay, here, there's this, and this to do.
We had prom the night before.
Well, that's right. I missed prom. But anyway.
Well, and you're retired, too. You're on a schedule.
She is retired.
I mean, it was exhausting.
So she didn't want to hear my stories when I got home, and that's fine. Anyway.
Yes, I did. I even asked you.
I'm just kidding you, Tacie.
Oh, whatever.
All right. PA Lydia, you're always good for a few stories. What you got for us today?
Well, I came...
I didn't ask you before the show, sorry, so I'm putting you on the spot.
Well, I told Tacie that I came a bit unprepared, and I was super excited about her topic.
Okay. Let's hear it.
I'm a bit... I have some stuff, but what? I need to talk more.
Yeah, there you go.
You can just pull the microphone closer to you.
I can talk about tourniquets.
Let's go.
Tourniquets?
I'm just kidding.
That doesn't sound interesting.
No, let's talk about Tacie's
tourniquet
topic.
injuries all the time.
I'll pop in.
Post-surgical...
there are
injuries.
problems.
Yeah, we see them all the time. I had one yesterday. Yep.
Well, you know what is crazy? We could talk a little bit, and this is when PA John was here. He was orthopedic PA.
Allegedly,
right? Yeah, sometimes I wonder.
Sometimes
as
we
well.
question his knowledge,
But one of the things that blew my mind when I did orthopedic surgery is if they're gonna operate on someone's hand, they put a tourniquet around the top of their arm, and they make it a bloodless field. They will cut off all circulation to that arm, and then they can operate it for an hour or two.
Yeah.
And then when you undo the tourniquet, it most of the time comes all the way back to normal. It's amazing how our extremities can deal with lack of blood flow that long.
Yeah, I think 2 hours is the accepted
Isn't that crazy?
limit. And they started doing that in like the 1500s, making a bloodless field.
Wow.
With tourniquets. Yeah. Anyway.
Can you?
That's pretty interesting.
Yeah. Can you imagine having a battlefield amputation done in the Civil War or something, where at that time the surgeons that were good were the ones that could do it the fastest. So if you could amputate a leg in under 14 seconds, that was considered, you were a good surgeon. Didn't have anything to do with your post-surgical complications, none of that. Get that leg off as quick as you can. Because can you imagine the pain?
Dang.
And I have a bit of a one-track mind, as I'm quite saturated with allied extract in Ukraine. But you've heard a lot about the Azovstal plant, the workers that Russia says they surrendered.
Yeah. Yes.
But what was happening was they just didn't have medical supplies. So people with leg injuries, as they got infected, they were just having to amputate them.
Oh my goodness.
There in the plant.
Goodness.
Because they didn't have like simple antiseptics.
Yeah.
So it's not just in the Civil War. It's going
that's
on
right
now.
Yeah. Fair enough. Do you want to give out a plug for your group?
Well, we could give you a plug, right? So thank you so much for sponsoring this convoy. We were able to get a bunch of. Is that okay?
Yeah.
We were just able to get a bunch of
I just don't,
medical supplies. I know Dr. Steve is very modest, but he's anyway. We were
You
able.
wouldn't think it's true. Shut up, Tacie. It is true.
We were very able to get some very much needed medical supplies into a very eastern city maternity ward. So
that's
and
awesome.
they sent back a heartfelt thank you video.
Oh, awesome!
So thank you very much for that. Yeah, we just continue to send in medical supplies to areas that don't have them. So hopefully we would not have people being amputated.
Yeah, no, it's awful.
Same limbs.
So give people if
same
they want to,
same lives.
If they want to donate, where would they?
Yeah,
go
just
to?
alliedextract.org. We're
alliedextract.org. And spell extract right, you all. It's not that hard.
EXTRACT.
Thank you.
Yeah.
Because I get people, I couldn't email you, and they're spelling weird, WIERD. So,
Well, that one is a hard word.
I know. How do you remember it? Well, the usual rule is I before E, except weird is spelled weird.
Weirdly.
You spell it weirdly. Right, exactly. Very good, Dr. Scott. All right. So, Tacie, what was your thing?
Overactive
thank you,
bladder.
Thank you,
I just
Lydia.
need to listen. I have been hinting and bitching about this for a while.
To me or on the show?
Well,
you can tell how much he pays attention
both.
to you and listens.
Yeah.
No, I got the message when I found that puddle of urine under your chair.
Yeah, and we've got to talk.
Okay.
And I don't know if this is really an appropriate discussion for this show because I don't know what percentage of women listen to this.
Well, most of the guys, a fraction of the guys who listen to the show have a woman that they live with that may have this problem.
Well, it's obnoxious.
Yeah, so talk about it.
So when I was at the concert, I had to know 30 minutes ahead of time if I would have to pee. Mm-hmm. That's stupid.
Okay. Yeah.
And,
agree.
And then you'd have to pee over and over and over again. And let me tell you, if you drink wine on a regular basis, Michelob Ultra doesn't do it for you. All it does is make you pee.
Piss. Yeah.
And so
you're just hydrating with the Michelob Ultra, I somebody we know.
Very, very hydrated. So anyway, but it's ridiculous, and they tell you to hydrate. Well, are you also supposed to pee? And
why not just piss in place?
What do you mean?
Well, you're at a concert, and you're surrounded by people.
No, come on, Steve. It's disgusting.
Okay. All right.
And so...
Sorry. Oh, I'm the idiot. Just kidding.
Yeah.
So
with that comment, maybe...
I'm editing that snort out. Okay, go ahead. That was Scott.
Yes. That was.
Did you snort?
Yeah. Anyway,
I snort.
Before the show, he did. Can't you tell? So, so anyway, so for you, because of your morals, you decided not to piss standing with people all around you.
No, but I'm sure
enough.
I was one of few who decided that because the floor was quite wet. But however, so there's overactive bladder. There's several things that you can have, right? There's overactive bladder. There's stress incontinence.
Mm-hmm.
There's what are the other things that you can have?
Overflow incontinence.
And how do you know which one you have?
Okay, well, let's do this. Let's take a short quiz, and you can answer. And Lydia, if you've got different answers. But there's a quiz.
She's a baby.
Okay, so she doesn't have it. But she has had a baby, so she could have some issues, As you pass that giant head through your vaginal canal, it can, sometimes cause some issues with the tissues around it. So
did have a C-section. But
okay, fair enough. Well, good. Oh, they can by God cut
interested.
it. Yeah. Okay. So, do you experience any of the following bowel and/or bladder control symptoms? Number 1, frequent urination.
Yes. But let me be clear. This is not a bowel issue.
No, I get it. I know. Okay. You can say that later.
Let the doctor ask his questions.
Sudden or strong urge to urinate.
Yes.
Urine leakage with little or no warning.
If you make me laugh, I might pee on
Okay, that's
myself.
different. So that's going to be a no. Urine leakage with exertion, e.g., laughing, sneezing, and exercise. Incomplete emptying of the bladder.
Yes, and this is very interesting or disgusting. I have to lean forward to get it all out.
Yes. Okay, and I know why that is, and we'll talk about it again. And bowel leakage, you said no.
That's not an issue.
Okay.
I do not poop myself.
How long have you had bladder control symptoms?
Okay, so in...
Less than... Okay.
Okay, I have to explain this.
This is our relationship.
Shut up. When I was in Virginia, I was afraid to drink anything because the GPS would send me down these godforsaken roads that wouldn't have places to pee.
Right.
My doctor suggested
they didn't have woods or anything.
My doctor suggested that they did, but I'm not doing that.
Yeah.
That I put a pee bucket in my car, which I decided was a no-go. So I just wouldn't drink
that works for
anything.
dudes. That doesn't work so well for women. How are you going to do that?
It's difficult.
Yeah.
It is difficult,
you could
but
get
some women are like, I don't care, I'll go ahead and do it.
What about a PureWick?
You could get just a porta potty and...
Are you guys familiar with PureWick? Lydia, you want to talk about what a PureWick is?
Yeah, it's like a suction. It's a catheter that is non-invasive.
There you go.
So essentially, it's a bit of a cylindrical shape that's curved toward the contour of the woman.
Mm-hmm.
As she urinates, there's a gentle suction that just wicks away the.
I could have had that
kind of like
when
a
I was
fancy
in Virginia
tampon.
because I was thirsty the whole time, afraid to drink anything because I was afraid I'd have to pee when my GPS would tell me to go down a road that GPS was not recommended.
Yeah, and then all of a sudden you would start feeling like you had to because you knew you were going to.
Yeah.
Let me PureWick in your car. Let me see if anybody sells
I
anything.
did pee in a cup while driving on a highway one time.
Well, I mean,
cruise control.
So you put the cruise control on,
I did.
and then you kind of hiked yourself up so that there would be some distance between your nether regions and the seat itself, and then jam the cup under there.
Now, did you tilt your seat forward? Because that's an old
Now, was this
trick.
I tilted it back, if anything.
Well,
the back goes, but the seat goes forward, gives you a little bit better angle. Yeah, a little more space.
I had a urinary tract infection at the time, I think.
Okay.
Looking back, it was college.
They talk like hick to you. She's with us. Amy's with us.
Okay, well, she may have something to say about it,
she
too.
might have.
There's a PureWick is a female external catheter, and then there's a PureWick urine collection system that goes with it, and it works outside the body to draw urine away. And I'm just trying to see, you can have it at home. I don't see a way that you could do it in the car, though.
Okay, because I started to say a day late and $1 short because...
But wouldn't that be something? Maybe we need to come up with something like that. Because dudes can get a Texas catheter. It's just basically a condom catheter that you could slip over your penis and then just urinate into that into a bag to your heart's desire. Richard Christie, when he goes to from the Howard Stern show, when he goes to concerts, he just wears a diaper and pisses and shits in it all day long.
Oh God.
Yeah. He said he doesn't want to miss anything.
Yeah, makes sense.
So there you go. I have another option for you. You go to Ozfest with David Miller, and you stand outside, and it's 108 degrees out there, and you drink 12 bottles of water and 2 or 3 beers and don't piss one time the whole day because you're sweating so much. That happened to a friend of mine. But anyway, yeah, seriously, 12 waters. I counted them. Never pissed one time.
So can we talk about medications and or like, are there generic remedies for this?
Sure.
Or
there's all kinds of things.
I remember there used to be lots of commercials for it on TV, and now I don't see that very often anymore.
Well, I think that the commercials have gone away because it is so inculcated in primary care now that they don't need to advertise anymore. So, there are lots of things that you can do for overactive bladder. The first thing to do is report it to your healthcare provider, because there are other things that could be, as Tacie alluded to. You could have urge urinary incontinence, stress urinary incontinence, and then urinary retention, which is where your ability to empty your bladder is so limited that the only time you can piss is when your bladder is completely full and under huge pressure.
So we were doing a quiz. Where did I end up on the quiz? Or did I interrupt you to the point where...
Yeah, that's fine.
Well, where do you think that I...
Yeah, you have...
you failed.
I failed.
Congratulations.
It's typical.
Yeah, I just wanted to get you to admit to all that stuff on the radio.
Thank you.
So there are tons of quizzes that you can take online, and if you have it, then and particularly if it's affecting your lifestyle. For example, for Tacie, I might not be so inclined to treat her now because it's purely you're going to take a pill all the time to just deal with the problem that happens when you are at a concert.
Well, what I worry about is at the beach.
Because you're drinking and you don't want to go back. Okay, tell everybody what you do.
I go to the ocean and I pee.
Oh,
what's wrong with that?
With friends.
Who doesn't do that?
We have pee buddies.
That's
me
common.
and my friend Karen.
See, the two women
or
are
my
like
friend
totally
Jill.
normal.
Does that?
Completely acceptable.
Yes.
Do you do that?
It's the ocean.
Scott?
Oh, yeah.
Do you?
Oh, yeah.
I can't
The fish
do it. Okay, the three of you do it.
But I won't pee in a lake because
Lakes,
that water does not
creeks,
move.
it doesn't matter.
No, that water does not move, it's disgusting.
What is it called?
So you'll see all these people at the
Fear to
beach
pee in front of others.
and everyone, every once in a while, they'll get up and they'll go out. Oh, I'm going to go swimming, and then they just stand there and look around, and then they turn around, and they come back.
That's me. With
and
my
you know,
friend.
everyone knows what you're doing.
And sometimes we have contests to see who can pee the fastest.
It's a little difficult with the waves sometimes.
But I just don't want to be up and doing that 6 times an hour with this. So is there a way you can treat it minimally, like only when you need
yes,
it?
Yes, you could. You could. Now, the problem is that the inexpensive medicines for this tend to have what are called anticholinergic effects. So the way that they work is by decreasing certain impulses to the bladder, and these impulses are ones that cause it to contract, right? And that same mechanism will also give you dry mouth and may give you fast heart rate.
Oh, I don't want that.
So you want ones that are specific and don't do that, but then those are more expensive. And but there are medications that you can take, and you could really, they're short acting, so you could take those on an as needed basis when you're at the beach. Although I wouldn't drink with them, that's the thing. But if you were, it's not explicitly contraindicated, but there's
that's just stupid then.
Okay, well, all right, but you could take them just situationally, as you alluded to.
Okay.
I haven't touched the camera in probably 20 minutes. Sorry, everybody,
Hey.
but anyway, there's all kinds of them. There's oxybutynin, that's the old school one. Then the antidepressant duloxetine which is Cymbalta was originally studied for overactive bladder and spastic bladder, and then it ended up being approved as an antidepressant, which I found interesting.
Yeah, that's interesting.
Yeah, it's number one. Tolteridine's number one drug that they were concerned about when they were rolling it out was duloxetine. And then they just shifted gears altogether and marketed it as completely something else.
Still peeing the same, but I feel so much better.
Right. So anyway, yeah, it is a problem. If it is affecting your ability to work or any other way that it
funny joke.
affects your lifestyle, then you should seek treatment for this. You do not have to live with a bladder like that. Mm-hmm. Now, I have a friend who has a prostate that is as big as a grapefruit. Mm-hmm. And he has to piss every 15 minutes. I mean, if we go to a movie, he's getting up, constantly getting up. It's miserable for him. Were you going to say something?
Yeah, I was going to say, and for especially for female bladder or urinary incontinence, it had electric stimulation acupuncture points has been shown to help reduce the incidence of the leakage.
Really?
Yep. Yeah, and I pulled one study up.
Wait a minute, I wasn't
PubMed.
paying attention.
Yeah.
What did you just say?
Well, I can put needles around your ankles and in your back and put electricity to it and lower the incidence of your incontinence.
You know what else you can do?
Wow.
If it's urinary incontinence that you're dealing with, like urinary incontinence.
Leakage, yeah.
Our friend Chanda does a procedure. It's called Votiva, and it's also been demonstrated to increase the tone of that upper vaginal wall, because remember, the lower wall of the bladder is the upper wall of the vagina, and if the upper vaginal wall gets weak, then the bladder will start to bloop down into the vagina, which causes Tacie's other problem.
Having to lean forward.
Yeah, having to lean forward, because now you have urine that's pooling in the bladder, and there are some women who have to wear a pessary, which is a device that you insert into the vagina to support the vaginal walls, or they will lean forward and stick their hand in their vagina and push up on the wall to get the bladder to empty completely. But it's just it's just a
mess down there.
Yes, it is.
So you need some.
But the Votiva, if you've got somebody in your area that can do the Votiva treatments, it has been shown also to help with that syndrome.
Is that where they use the probe and go in vaginally and do like the electrical?
Yeah, it's radio frequency and microneedling. I think there's microneedling involved with the Votiva. I know at least it's radio frequency.
Yeah.
And it tightens everything up. And the thing about it is, I can't do that procedure. I think we've talked about on the show, if I get a woman in the stirrups and I stick the Votiva probe in their vagina and start going in and out and in and out and all around and then back in and out and in and out again, the second I'm done, if they don't stop me, 2 minutes into this, they're going to run straight out of there and run to the cops and say that doctor is a damn pervert.
Yeah.
He assaulted me or whatever. So Chanda does that one. I can't touch that machine.
Hey, well, I don't have to stick anything in your vagina, which is nice.
Okay.
That is nice.
Ankles and back.
Ankles and back.
Yeah.
Ankles used to be a little spicy, but I think they're acceptable now.
Yeah. Yep.
I saw a hint of her ankle. Can you imagine?
No. We're so far from that now.
And showing somebody, like if you wanted to be coy and coquettish, that you lifted up your dress and showed someone the ankle bone.
If only
and they were like, oh, she's flirting with him.
Yeah. All you got to do is go to Splash Country, and then you see everything you want to see.
Yep. Dolly's Splash Country, including pubic hair down to your knees, sticking out of your bikini bottom.
And 450-pound women in bikinis.
Yeah, well.
Down to the knees.
At least.
Yeah.
It was just the most unbelievable thing I've ever seen in my life.
I'm never going.
And it's fun other than that. Just don't look at other people. How about that? If we just don't pay attention to other people, then we won't judge them, and maybe they won't judge us. How about that?
It's not judgment, I guess.
We were pretty judgmental about that.
I was very judgmental.
Because it was like you see it and it's like,
just cut it off. You don't see that? You know what I mean? I'm sorry. The hair down to your knees.
Coming through your bikini bottom. And it's your
You're trying
pubic
to be nice,
hair?
but deep down.
There's got to be, it must be nice to feel that good about yourself.
Yeah,
like that
or not
confident.
care.
Or not
Just-
care.
yeah.
That would be
That's freeing.
lovely. And okay, so
That's
I get
actually a
your point.
pretty good point.
Mm-hmm.
It's just somebody doesn't give a shit.
Still disgusting, but good for her.
Yeah.
Must not run a lot.
I don't give a shit about what I look like until I see a picture of myself. When I look in the mirror, I can fool myself. Hey, yeah, you're looking pretty good. And then I see a picture of myself. I was like, who's that old asshole with the head shaped like an eggplant? That's me. Oh, God, that's me.
You do not look like an eggplant.
Yeah, I do. All right.
Should we answer a question?
Yeah, you want to?
Yeah.
Okay.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to Snacks and Wet Napkins. You know how messy you are.
Dad.
Walmart. Subscribe to your weekly list.
Pasajeros a bordo, bienvenidos al Friskies Express. Por favor, mantengan sus patitas y colitas dentro del tren. A su derecha verán Crunch Canyon. A la izquierda, Philae Falls. Ahora pasamos al Pico Party Mix. Hoy el tour delicioso está por terminar, pero no hay problema, porque con Friskies siempre hay algo más para explorar. Ve a friskies.com para explorar más.
Hi, I'm Lara. After 20 years of making Lara Bar, I still believe that simple and real can be indulgent and delicious. From chocolate chip cookie dough to cherry pie, there's a Lara Bar made for you. 100% real, 100% delicious. Find your flavor at larabar.com.
This episode is brought to you by Dove. You use all the right skincare products for your face, but your body has been missing out. With new Dove Serum Body Wash, you can give your body the vitamin C glow it's been wanting, the hydration boost it's been craving, and the active skincare ingredients it deserves. It's time for your body care era. New Dove Serum Body Wash. Get Dove or get FOMO.
Okay. All right. You got any from the waiting room, Dr. Scott? Get some ready. If y'all have any questions, throw them to Dr. Scott.
Number one thing. Don't take advice from some asshole on the radio.
So this is a good one for all of us. I think you'll find this quite fascinating. And this is...
Hey, Dr. Steve, I'm sitting here with my son as he's telling me about some Liver King dude and some bone marrow capsules he wants to take because he read some damn article about these bone marrow capsules helping with some recent shoulder surgery he had and some healing in the joint there. And I'm calling absolute bullshit on it. Just another internet thing. And he claims he's verified this stuff. So please,
it's documented.
Settle the argument for us, please.
Okay.
Thank you.
You're welcome. Thank you. Hell, if he had his kid in the background, they're both laughing. So bone marrow supplementation. At first, I just texted him back because if you email me or leave a voicemail, I'll try to have the courtesy to at least respond. And I responded with all caps, he. But then I said, okay, I better go look it up. because any time that I just call bullshit on something, I always want to make sure I can bring my receipts. Now, there are some health benefits to bone marrow, at least that are purported. I couldn't find a damn thing in the medical literature, but what I could find were data that showed some beneficial effects for some components that are in bone marrow. But a lot of the things I saw were talking about bone broth, where you take bones and you boil them and then use them as a base for something else. And in that case, there are things like gelatin, which, it has got some benefits, but you know where else you can get gelatin other than bone broth? Gelatin, Jell-O. So you don't have to eat bone marrow to get gelatin. Now, one study showed that there's fat tissue in bone marrow that contains a hormone called adenopectin. And that helps to break down fats, and it can maintain insulin sensitivity, and it's been linked to lower risk of diabetes, cardiovascular heart disease, and other stuff like that. Whether it's in the doses that are in these bone marrow capsules, and if you go to look at these, I'm not going to say any of the, oh shoot, I just closed that one. That was a good one. It was like, I went to Amazon and Googled bone marrow. You do that, and it was like ancestral bone marrow capsules.
wow.
And don't know what that, I guess that means that's paleo stuff. And that's how they're selling it. But when you take bone marrow, for example, and then run it through that process we talked about with those other people that do this with fruits and vegetables, and freeze dry it, and it's called a process called lyophilization, where you put it in a really cold environment and then you hook it up to a vacuum and all the water will come off and you're just left with this powder. I don't know how much adenopectin you need to get to have this effect and how much is in this stuff. Just because it's derived from bone marrow doesn't mean it's good for you, So bone marrow is full of collagen. Is it still when it's rendered down to capsules? By the way, you have to take 6 of these capsules a day. And it's like $60 for a bottle of it. That was the cheapest one that I could find. Bone marrow has glucosamine in it. But we have discussed glucosamine on the show before, that it has some data that shows that for arthritis, it's at least as effective as 400 milligrams of ibuprofen without the risk of GI bleeding. That's great. Just go buy glucosamine then. I'm never a fan, except with maybe marijuana as the example that would be counter to this, of taking just 10,000 molecules to do one effect, and maybe 9,090 of them don't have anything to do with what you're trying to fix. That's why I really don't like things like NyQuil, because what if you don't need the antihistamine in there? You just need the decongestant and the cough stuff. Well, just take that separately. Treat your symptoms, break your symptoms down, treat those. So that's the issues I have with this. It just, it's got glucosamine in it. How much does it have in it? You need 1,500 milligrams of glucosamine really to start to have any decent effect with this stuff. So it does reduce inflammation and et cetera, et cetera. There's glycine in it. Well, you could just take glycine. You know what I'm saying? I couldn't find a single thing in bone marrow that you hadn't already been studied somewhere else and maybe have some data in it, but you could buy somewhere else without eating some poor animals, insides of their bones.
Well, it's a delicacy, right? In
Sure,
some places.
sure.
But then at what temperature do those proteins denature?
I don't know.
Right? So then how much of it do you even absorb, and where do you even absorb these things?
Right. They're saying, 1% of the RDI of phosphorus. Why even report that? That's like, you might as well just say there isn't any in there.
There's been a trend with collagen.
Yes.
Big trend.
Huge trend.
Yep.
I can't wrap my brain around how you absorb.
You have to break it down into its constituent amino acids, and then you incorporate it into your collagen, so that the building blocks are there. That's the only benefit I can see. I can't imagine another mechanism. What do you guys say in traditional Chinese medicine, Dr. Scott?
Well, the old theory was that, and I mean, it goes back to the Chinese and Native American Indians as well, that eating organ meat for certain organ deficiencies is
Sure.
helpful.
Yeah.
And certainly bone marrow, bovine extracts, things like that. I mean, some of those are even used in certain prescriptions for irritable bowel. Like the what's the?
It says here bone marrow can be enjoyed just like butter. Spread some on a cracker or a piece of toast.
So why not enjoy it? Why put it in capsules?
Just like butter. Well, that's the American way, is we render everything down, make it into pills, and then take it, and then figure we can do whatever the hell we want.
Well, I mean, hell, we even take horse urine and make medicine out of it.
That is true.
We can, I mean,
Lest anyone think that Dr. Scott's crazy, he's not talking about traditional Chinese medicine.
No, I'm not.
He is talking about Western medicine. Pregnant mare's urine is where the estrogen supplement Premarin gets its name from. So he's absolutely right. I'll give you one of these.
Give yourself
Scott.
That's a pretty terrible thing they do to those horses. Too.
Is it?
Yeah, from what I've read. I mean,
Well, they give them. They give them a catheter and they collect their urine. It's a little less horrible than chopping their hooves off to make Jello for some kid.
That's true.
You know,
They should get a wick.
and render them down to make glue. So. But I know what you mean.
So I'm voting a possible.
We don't need to do it
for
anymore.
for the kid's supplement for the shoulder. I'm voting possible.
Yeah, I'm not saying that there's no benefit to it. Again, how do we know something has a benefit? You got to identify your endpoint. I know people are getting sick of this, but people can recite this now, and people recite it back to me now. We got to define our endpoint. What are we trying to study? What benefit do we want? You can't just say, "Is it good for you?" Well, for what? For curing cancer? No, it sucks. For your, increasing or decreasing the interval from your shoulder surgery to when you can use it again, maybe. I don't know. So maybe that's our endpoint. We take 1,000 people who had shoulder surgery. We give them all. We match them to make sure the complication rate is the same. All that stuff. We give them all physical therapy, all the normal things that you would do, and half of them we give, bone marrow to, and the other half we don't. And the other half gets a placebo, and nobody knows what's what. And then at the end, you decode it, see who got the placebo, who got the bone marrow, and is there a statistically significant difference in the endpoint you were studying for, which is decrease interval from surgery till back to normal. And then you got to define what back to normal means. Okay, so does it mean that they can lift a certain weight or what a certain percentage of their body? And you can argue with these things when you start trying to make one of these studies. It's like, how can we make this concrete? And it's really hard to do. But if you did that and you could show that, I'm all in. That's all I need. Just give me data. Just don't make up stuff.
All I can do is think about when my mother-in-law broke her tib fib in my stairwell.
Yeah.
Normally lives in New York City, but was down visiting.
So her tib fib is the tibia and fibula, which is the lower bones of the lower leg. So go ahead.
So she fractured those whilst on vacation at my house. Ended up staying for about 12 weeks because it required a surgery. But she was convinced that eating chicken feet would help reduce the interval between time of surgery.
I've heard that because they've got
collagen.
So she'd sit and eat chicken feet.
Oh, goodness.
Fried chicken feet?
No, boiled chicken feet.
That's good eating, I'll tell you that.
Boiled chicken feet. So there'd be a
cityfied folks don't we talk about chicken feet like that.
Plate of chicken.
You ain't know what
parcels.
you're talking about till you tried it.
They do sell them locally.
Them's good meals. We make chicken foot stew and chicken foot jubilee. Chicken foot jubilee. That's where I stop. It's ridiculous.
Chicken foot jubilee.
That is awful.
Sounds Catholic. It's a little Catholic.
Chicken foot fandango. We make all kinds of stuff with it. Y'all don't know. All right. I don't know where that came from. Sorry.
I don't either.
Especially since she was from New York, but I guess her Delmer was agreeing with her, but did you think it helped? It helped. She thought it helped, so that's all that matters.
Perhaps.
Didn't hurt anything except
me.
But and the chickens. The chickens who were running around on stumps, it didn't help them any.
Definitely.
Did you throw the pot away when she left?
And the bowl that would just be full of chicken tarsals and metatarsals, phalanges and toenails.
Love it. Hey, we do have one from
Okay.
Ryan Kurtz, if you
we got to
like
follow up on completing the transaction, too. Go.
Oh, yeah.
Yep.
Ryan Kurtz's 7-year-old daughter has a Monte Geyer fracture, dislocated radial head. The orthopedist.
Wait, what?
Yeah, it's a pretty not a super common fracture of the ulna.
Huh.
And they did a closed reduction, which is more common for kids if they can do it and get it back in place and not have to do a surgical. But his question was,
You mean a Monteggia fracture?
Monteggia.
Okay.
Monte Geyer.
Go ahead. Okay.
It's how they say it in Chinese, of course. Mm-hmm.
Okay.
I think maybe my son.
So what about it? What was the question?
Yeah, he was asking. He knows it's misdiagnosed quite often. He was asking about recovery time for her, and of course, a lot of that's going to be based on how healthy she is.
So she had to have the open reduction internal fixation. Is that what he's saying? It was they had to go in.
No, they did a closed reduction last week.
Okay,
so it was close. So thankfully, it was not an open.
Okay, so in children, the results of early treatment, which I'm sure that they did, is usually good. Mm-hmm. Typically, they come totally back to normal. If they diagnose it late, and then they have to have reconstructive surgery, then there's a lot more complications with that. So it sounds like they're that they caught it early and they're going to take care of it. So.
Yeah, maybe 4 times. Maybe 4 weeks or so. If she's healing,
I would have said
quickly.
12, but that's just because I always say 12 for healing anything.
For full healing. But I would say she should be able to start moving it pretty quickly if they got it back where it's supposed to be after about a couple weeks.
Now, if they have to open it up and then align the bones and then put plates and stuff like that, and there's a lot more complications with that. So if they can do it with the closed reduction, it's always better. Good.
Yeah.
Good. Okay, well, give her our best. And she cannot listen to this show, but just tell her that the mean and weird people on the radio said that they hope that she get better quickly. All right? What was the other thing?
Colin Carnes asking about significant shrinkage. Did you see that?
No, I did not see that. Let me do this one about completing the transaction. Maybe we'll do that one after.
That's cool.
Hang on.
Guten Tag, wie geht's?
Hey,
Doc,
hey,
this
dude.
is Dee from Texas.
Hey.
I was calling you back about the not completing the transaction type deal.
Yeah.
I completed every time.
If you didn't listen last time, he called about completing the transaction. We had to go over a lot of things because we didn't know what he was talking about. We didn't know if he was getting an erection and then starting to have intercourse and then losing his erection, or if he was having an orgasm but nothing was coming out the end of his urethral meatus, which would suggest retrograde ejaculation, or if he had delayed ejaculation, meaning that he could just go and never have an orgasm.
When I'm jacking it every time.
Okay.
Yeah, I complete it every time when I'm jacking it every time.
Okay.
And I think a lot of it is mental.
Yeah. And we predicted that as well, if you recall. We said if the test that we gave him was, can you complete the transaction while you're masturbating? And if you can there, but you can't while you're having intercourse, that usually indicates a psychosocial or psychological overlay. And it could be a lot of different things. It could be that you're distracted, or you have performance anxiety, or you're having issues with being attracted to your partner or whatever, or maybe they're not attracted to you and they're not into it or whatever. But
I think a lot of it, because I think I told you not too long ago, my dad passed away, so I think there's a lot of grief still in there.
Yeah, I'm sorry about that, dude. I didn't remember that.
And there's just been a lot of things going on in my life.
Yeah.
I think a lot of it's like psychological. So anyway, I'm just going to follow up.
Okay, man. Yeah, so if this persists, I would talk to your primary care. There are sex therapists out there that can help you with this. And if you email me, I'll send you some resources too. And I'm still not clear if he's just having trouble not ejaculating and having an orgasm when he's having, penis vagina, or if he is losing his erection. But either way, he doesn't have a problem when he's by himself. So it's the addition of the other person. And you do have to actually pay attention to the other person. And if you're wrapped up in grief, that's hard to do. And that may take you away from the ability to just lose yourself in the moment. So, all right. But yeah, send me an email and I will send you some stuff on that. So, Scott, you had a question from the waiting room, I understand.
Yes. Colin was asking, what are some other causes of significant shrinkage other than a cold swimming pool like George Costanza?
Oh, that's a good one.
Mm-hmm.
So, Tacie, you want to take this
That
one?
makes me smile, just remembering that Seinfeld episode.
Just the shrinkage! The shrinkage!
She's got to know what shrinkage is.
That's why I'm smiling, because that...
Oh, yeah. It wasn't, you were looking right in my eyes and she's smiling when they're talking about the shrinkage. But it was George Costanza. That's fine. Yeah, totally fine.
So, no, I have no comments other than great episode.
Have you heard of COVID Dick?
No.
Well, COVID Dick is an issue that has not been confirmed as a syndrome, but has been discussed online by medical professionals. And here's an article from McGill University, which is in Canada. It says the penis and testicles are not always spared from COVID, but a pro-vaccine public service announcement put too much stock in a limp study. Okay. So anyway, there are some issues with male urogenital health and COVID-19, and there are a lot of guys that swear that their penis is more retractile now than it was before they had COVID-19, and I'm here to tell you I'm one of them. So I have noticed that my cremaster reflex. Okay, so let's talk about this a little bit. So there's some muscles in the lower pelvic realm, particularly of the male, that do a couple of things. One of them is to pull the scrotum up closer to the body, to particularly if the testicles are getting too cold. It will do that to try to maintain a constant 3 degrees of temperature lower than body temperature. And there are also muscles that can relax or contract that will retract the penis into the body. And I'm telling you, I noticed since I had COVID-19 that although when aroused, the length is and the girth is exactly the same as it was before, but when I'm walking around, it's less dangly than it was before. And I think significantly so, to the point where I noticed it. It's like, what the hell is wrong with me?
Is that a good thing?
No, it's not a good thing. No,
I
it's
mean,
weird.
I don't know how they walk around with those things.
I know. Sounds complicated. At least they can pee when they're driving.
Tacey's never seen one, so it's fine.
I don't see it.
But yeah, I swear that I've noticed that. And I'd be interested if anyone else has noticed it. Please have noticed it, so it's not just me. But I've read multiple people on the internet have discussed this, including some decent I haven't seen a study done on it yet, but it's been complained about enough that places like McGill and other well-established medical websites are starting to comment on it.
Well, it makes sense, right? Because of the vascular complications that we see with COVID.
Yep.
And then other diseases that cause vascular compromise, like diabetes, atherosclerosis, cigarette smoking, they all are associated with increased shrinkage.
Well, yeah, fear, seeing something that frightens you will cause
really? So
shrinkage.
Adrenaline?
Because it draws everything up back in.
Raynaud's syndrome?
Raynaud's, yeah.
There were quite a few men. There was an online survey of just 100 Italian men conducted in April 2020, which is pretty early on. 25 of them said they had COVID. The remaining 75 said they had not. When asked about erectile dysfunction, under a third of the COVID-positive men said they were experiencing it, but only a tenth of the COVID-negative men. Now, this is not a scientific study by any means, and it could have been selection biased, because people who had erectile dysfunction might be going to a website looking for information and taking a survey. But it is kind of interesting. So we will see. Here you go. While the penile impact of the coronavirus remains worthy of investigations, including a story of a man who claims to have lost 1.5 inches of penile length, possibly because of damage to blood vessels, it seems like premature extrapolation to scare men into getting vaccinated because of erections are at high risk is unwarranted. So I agree with that. They shouldn't use this as a tool to get men to go get vaccinated because we don't have rigorous data on this. But those are the main things. It's usually environmental, trauma. Bike riding can cause issues with the pudendal nerve, which is a nerve that's a sensory nerve that goes to the penis and scrotum, but that causes neuropathy if you're a bike rider and you ride on a bicycle, one of those banana seats, and put a lot of pressure on your taint. But I've not seen anything that had anything to do with shrinkage there. But anyway, yep. I think I'll have to call this podcast Whiskey Deck just to get some people's comments on that. But anyway, so yeah. Should not be used as a public service thing to try to get people to get vaccinated, but I think there may be something there. I have been interested in trying that extracorporeal, in this case wouldn't be extracorporeal, would it be external shockwave therapy for erectile function? Because, look, at 66, it's still working. A cat could scratch it now, whereas when I was 18, a cat couldn't scratch my, giant meaty erection, but it certainly could scratch it now, even though it's still decent. I just would think it would be interesting for the purposes of this show to try it and do a before and after.
Have a
tumescence test.
Scratch your
Would you be willing
pegger?
To do that? Yeah, what exactly?
That'd be interesting.
Well,
Yeah,
we know
I have a tumescence meter here.
Okay.
I got it for an appearance on Opie and Anthony that ended up not happening because Opie got, left the show.
And we have a cat.
And we do have, we have a cat.
We're good.
Yeah, we're good.
You got a guy that can do the therapy for you.
Yes, exactly.
But what we would do is Tacie would, she would have to grasp and then compare to the tumescence meter. And we would do like 10 trials before. It would be 10 different times. We'd take the average, and then we'll do it after and see if we can tell a difference.
That sounds fun, guys.
It would be fun.
Okay. I'd have a good time doing that.
Yeah, you grip. So what you do, Tace, is you grip it, and then you kind of, go up, grip it a little higher, and then a little lower, and then a little higher.
Sounds like it's going somewhere.
And then a lower, and then a little higher, and then a lower,
yeah.
and then.
Do that 10 times.
in a rhythmic fashion until I tell you to stop. Which I will do through sign language and moaning. But anyway, all right. So maybe we'll try that.
Okay.
I got to get Chanda to buy one of those machines first. Okay. Well, you guys are just
Do
all
you think
just
there would
staring
be?
at me,
Would
so
you
at
like
this point,
market
it's probably-
that? Would Chanda be willing to take that on and you market that?
Oh yeah. I would not let her do it. I would have Tacie do it because Tacie would find that odd. But I would absolutely be a guinea pig for that. I think it'd be fun.
I think a lot of people would be interested.
I'm going to edit out all the pregnant pauses in this segment of the show, but thanks, everybody.
Thanks, guys.
Thanks,
There's just a lot to consider.
I know. You guys, you started going visual with it, and then there were no words.
Well, you were doing sign language.
True. Thanks always go to Dr. Scott, Tacie, PA Lydia, always a delight. Don't forget to check out PA Lydia's newest endeavor at alliedextract.org.
Oh, I used to be the secretary. Now I'm the executive director.
Ooh.
What?
Yeah, I'm telling you, we're a very progressive organization.
Yeah, we're very small, and they found somebody dumb enough to do all the work. That's happened to me before with certain organizations where they're like, "Oh, you'll do work. Okay, guess what? You're the executive director."
Yeah.
No, that's cool.
We call it the day-to-day, handling the day-to-day.
Yeah, that's awesome. Good for you.
It's
Congratulations.
really,
We'll give you one of these.
Yeah,
Just for being cool.
I thought it was funny.
Yeah, check out alliedextract.org.
I think it's cool.
We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, That Gould Girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete barkeep blower, the Dolly, the Dolly Dallier, the Dolly Museum Diddler, the Bolshoi Ballet Bimbo, Percy Dumb, Roland Campos, sister of Chris, Sam Roberts, she who owns pigs and snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double Steve Tucci, the great Rob Bartlett, Adam Goldstein, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Talipes Equino Barris, producer Chris, Jenny Jingles, the inimitable Vincent Paulino, everybody. Eric Zane, Bernie and Sid, Martha from Arkansas's daughter, Tucker Carlson. No, Tucker Dixon. Different Tucker.
This just goes on.
Ron Bennington, and of course our dear departed friends, GVAC and Fez Watley, whose support never went unappreciated. And listen to our, shut up, Tace. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. See, Cletus calls Tucker Dixon Tucker Carlson because he doesn't know his name.
Okay.
And so, since Cletus lives in my head, okay, anyway, Tucker Dixon, everybody.
Sure.
He's our friend.
You get what you deserve on that one.
All right,
see you guys.
Bye.